Okay, folks, what you're seeing now is he's basically having, again, I'm going to miss the word, and I asked it earlier.
Is this
A TINS unit. A TINS
unit.
unit.
Yeah, that we're stimulating some strategic acupuncture points, primarily for endorphin release, but also nerve transmission.
So, and this boy is dirty, folks, but he's going to get a bath today. Dr. Jackson approved him for baths, so he's going to be looking better when we video him tonight. Look at that happy face. Look at that happy face. Okay, just lay down, big man. Just lay down, big man. Oh, are you saying hi to the folks? Are you saying thank you for your donations to help me? Is that what you're telling them? Yeah, he's such a good boy. Okay, go CP. Go CP. Yeah, he's such a good boy. And he's very vocal. What you're hearing, he's not upset, he's not hurt. He's just being extremely vocal because this dog literally talks all the time, folks. So I don't want you to think that the vocalizations are any kind of distress. He's just a talker. And there's something about a shepherd that's a talker that just steals my heart. And he probably feels better than he's felt in a long, long time. But not as good as he's going to feel after a bath. Everybody needs a bath. See my hands? Look at from petting him. So, but we waited to get him to the vet and get permission. Oh, he's such a good boy. He's such a good boy. Yeah. Yeah, he's such a good boy. Do you actually think he's 7? I'm looking at his teeth and I guess maybe that's not a fair question to ask you on camera, but he just doesn't seem to have the tartar and the wear. Okay, I'm not going to put Dr. Jackson on the spot, but folks, I don't think this dog is 7. That's my personal opinion. That's what we are told out of Miami-Dade. So we're going to give him as long a run as we can with as high a quality of life with your help. And we'll keep you informed as to what he's going to need. But he's going to need ongoing treatment.
Yeah, degenerative myelopathy it's a disease that's difficult to diagnose because it's called a diagnosis of exclusion, which means you rule out all the other potential possibilities that could also cause the same symptoms, and then say, well, it's not any of those, so that's what it is. But if it quacks like a duck, looks like a duck, it's probably a duck. So with him, I feel like he does have potential a mild arthritis as well, and we can confirm that with x-rays down the road, but his left side hip does not extend quite as much as normal or as the right side. So he probably has a little bit of arthritis in component. And what happens with degenerative myelopathy is that the nerve transmission from the back end to the brain slows down, and eventually the nerves degenerate to the point that you're not transmitting at all. And so it's a slowly progressive disease, meaning that it gets worse over time, and at this point right now we have not found a way to stop it. But we have found many, many ways to try and slow it down. Antioxidants being a big key, and then use Chinese medicine to support their overall energy and the energy in the back end to try to slow the progression as well.
Dr. Jackson, what about stem cells? Is there any implication for use of stem cells with DM patients?
As of right now, there is not any that I know of.
Okay.
If I were to put it, kind of categorize it something close to human disease, multiple sclerosis is probably like Again, it's a degenerative progressive disease.
Right.
And you can find false reports on the internet all over the place that stem cells help with that. But according to Duke University, that is not true, and I trust them more than I trust
the internet.
Dr. E from Guatemala.
I understand.
Okay.
So anyways, our boy is now getting his TENS unit treatment. He's already had his chiropractic treatment, and folks, we're always coming back to you with more.